So this is, when people say we should compromise, some of the arguments that or responses that we have to that is that the National Improved Medicare for All system is the smallest incremental step that will move us on the path to a universal healthcare system and solve our healthcare crisis. That when people say it's too much, Medicare itself was created in less than a year as an entirely new system without using any computers. They enrolled 19 million seniors into that system. We're already paying for universal comprehensive health care, so if we don't do that, why are we spending this much money and not covering everyone? Single-payer healthcare systems around the world and in the U.S. are well studied and proven to work. We already have detailed proposals over the past number of decades. There have been many articles published in peer-reviewed medical journals talking about how we do this. This is countering the argument we often hear where people say, oh, those people want single payer, but they're all pie in the sky. They haven't actually figured out how it would work. And we have a lot of detailed proposals that would show how it works. We have models of single payer in the United States, our traditional Medicare and our VA system that we can use, to show how these systems work. And another argument that's put out there is that other countries have private health insurance in their systems or have moved to privatize their systems, and all of the countries that have allowed privatization into their systems have seen higher healthcare costs and declining satisfaction and more difficulties in obtaining care. So just some responses there for you if you start to run into people that say we're asking for too much. All right, next slide. So people say that it's not politically feasible. We have to remind ourselves that feasibility of reforms depends on the political winds, and that's something that we have the power to change as people. I've seen this in a number of fights that I've been involved in, from fighting for net neutrality in 2014 when we were told that that was impossible, to stopping the Trans-Pacific Partnership, a huge trade agreement we were told we couldn't stop, and we did. So we know that when we organize, we can change what's politically feasible. A single-payer system is really the only kind of solution that, or socialized type of healthcare system like the UK, that will actually solve our healthcare crisis. So people may say that certain things are politically feasible, but they're not really practically feasible if they don't solve the crisis. We already have a majority of public support and health professional support for Medicare for All. Business leaders are coming on board now, even conservatives coming on board, seeing that this is necessary. There have been a number of articles talking about how even the most capitalist countries recognize that healthcare doesn't belong in the marketplace. When we advocate, we know that people are inspired and motivated to fight for something when it's actually a bold solution, something that they want. And so these lackluster solutions just don't get people to turn out. And there will always be opposition to health reform, no matter what we're advocating for. So our best strategy is to present something worth fighting for. President Obama, decided to compromise from the beginning because he didn't want to have the same fight that the Clintons had in the 1990s. And of course, his plan, even though it wasn't, was called socialism, death panels, all this, stuff. No matter what we do, we're going to face that. So we should put forward something that we want to fight for. Let's go to the next slide. This is another quote from David Barton Smith, and he reminds us that the practical mechanics of how to make a universal health insurance system work is a lot easier than trying to patch together the current system that we have. Medicare has been around for a long time, and people want it, they like it. And polls show that even conservatives have a strong support for Medicare. And now, because of the Medicaid expansion, there's even strong support for Medicaid. And I've seen this myself when I'm out talking to people across the political spectrum. Nobody wants their Medicare to get messed up. So this is why we advocate for that.